get at the
Oh, yeah.
big one there. And it was like, it's very experienced, one of the better. Was it so good? It was just a regular beer, I'd imagine.
I mean, it looks like
better.
it looks like a movie.
Right?
Yeah.
A couple of times I was thinking this needs to go.
Yeah.
I wanted to see more.
I was wondering if it would translate over. But it's like, that theater was just a kind of big theater.
It was really good. I just action.
Welcome, everyone. I call this Committee of the Whole meeting on Tuesday, August 18th, 2026 to order. First item of business is the adoption of the agenda. Before adoption, any changes from staff? All right, can I have someone move adoption? I saw Councillor Southcott. All in favor? Any opposed? Carried unanimously. Next item, motion to close the meeting to the public. Can I have a mover for that, please? Councillor Southcott.
I move that committee move into a closed meeting to discuss matters covered under the community charter covered by the community charter under section 91A, personal information about an identifiable individual who holds or is being considered for a position as an officer, employee, or agent of the municipality or another position appointed by the municipality, and see labor relations or other employee relations.
Thank you. All in favor? Any opposed? Carried unanimously. All right, we are now heading into closed meeting and we'll reconvene the public meeting at 3:30.
Let's just put it that way.
Welcome, everyone. We are reconvening the Committee of the Whole for Tuesday, August 18th, 2026. We opened the meeting earlier today at 2 o'clock and are reconvening and open now. I will start by acknowledging Tla'amin territory, Cheche Hoch Tla'amin Kaimu Asna Te'egije, which generally means acknowledging the land of the Tla'amin people and their stewardship since time immemorial. Before we go into public input period, taking liberty as chair, this is my last scheduled session as chair of the Committee of the Whole this term, and I just wanted to appreciate being of service in this role. So first up, public input period. So public input period allows up to 3 members of the public to have an opportunity to provide comment for a maximum of 2 minutes on items listed under legislative matters, committee recommendations, and new business. And today we have 2 items under new business, the accessibility and zero waste at city outdoor events and dogs at Willingdon Beach. Are there any members of the public that wanted to speak to those items today? Is there anyone online? All right, we'll carry on to the next item, which is general matters. The first item is Fire Department Long Service Award. And so I am looking forward to acknowledging, I believe there are 7 firefighters here tonight or this afternoon receiving long service awards, and I am pleased to be able to present them. I'm going to come down into the audience so that I can shake hands. I think there's a microphone I can use. That's what we did last time. And I'll let everyone in the community know a little bit about the long service of a number of our members tonight. All right, where's best for me to stand? Right here? Okay. Was that? Block you out? Yeah, okay. First up, for 25 years of service, Captain Brad Collicutt is receiving the Provincial Office of the Fire Commissioner Long Service Medal. Brad began his fire service career with the Malaspina Volunteer Fire Department in August 2000 and joined Powell River Fire Rescue as a career firefighter in March 2007. Brad moved to Powell River with his family in 1983 and graduated from Max Cameron Secondary School in 1996. He has dedicated more than 25 years to the fire service and the community he calls home and is the current president of IAFF Local 1281 Firefighters Association. Thank you so much, Brad. Next up, for 20 years of service, Sid Allman is receiving the Federal Exemplary Service Medal. Sid joined Powell River Fire Rescue as an auxiliary firefighter in December 2005 and became a career firefighter in May 2009. Raised in Powell River from the age of 3, Sid graduated from Brooks Secondary School in 2005. He takes great pride in serving the community where he grew up and continues to call home. Thank you so much, Sid. Another award for 20 years of service. Brent Del Giudice is receiving the Federal Exemplary Service Medal. Brent grew up in Powell River and served as an auxiliary firefighter with Powell River Fire Rescue for 18 years. 2 years ago, he was selected to serve as temporary flex firefighter, continuing his long-standing service to the department and community. Thank you very much. And not here tonight, I also wanted to acknowledge Kevin Cote also receiving a 20-year service, Federal Exemplary Service Medal. So thank you, Kevin. Next up, we have a number of 10-year municipal fire service awards. First up is Jesse Hildering. Jesse is receiving his 10-year municipal fire service award. Jesse moved to Powell River with his family in 1999 and graduated from Brooks Secondary School in 2005. He joined Powell River Fire Rescue as an auxiliary firefighter in March 2014. Jesse later attended the Justice Institute of British Columbia Fire Academy, graduating as class valedictorian, and became a career firefighter with the Powell River Fire Rescue in September 2019. Thank you, Jesse. Next up is Chet Rockwell. Chet is receiving his 10-year Municipal Fire Service Award. Chet graduated from Pitt Meadow Secondary School in 1991. He and his wife moved to Powell River in 2008, and Chet joined Powell River Fire Rescue as an auxiliary firefighter in January 2015. He became a career firefighter in 2021. Welcome, Chet. Next up, we've Andy Milne. Andy is receiving his 10-year Municipal Fire Service Award. Andy joined Powell River Fire Rescue as an auxiliary firefighter in March 2014 and has remained a dedicated auxiliary member ever since. In addition to his service with the department, Andy works part-time with the city and full-time with BC Emergency Health Services. Thank you, Andy. And also not here tonight, but also receiving a 10-year Municipal Fire Service Award is Tyler Brady. And finally tonight is Julian Welp. Julian is receiving his 10-year Municipal Fire Service Award. Julian grew up in Powell River and graduated from high school in 1994. He joined Powell River Fire Rescue in 2011 and continued serving the department and his community until his retirement in 2026, completing 15 years of service. Thank you, Julie. We have to redo the photo with Brad? Okay. Thank you. Oh, okay.
That's all right. How many?
Oh, nobody asked us. Nobody asked us.
Cheese and muffins.
No, she knows.
They're just gonna do shots.
Way too long. Oh. Supposed to have.
No.
That's all.
The photo? We would love to, but we weren't sure that's what we were, or at least I would.
I think if you're setting up, if you guys wanted.
Take the one.
Okay.
It's a newspaper who set it up.
Sure. Easier
We
to
should-
set it up. Newspaper just reports the news, so if you want to be in the news,
You want to be in the.
Let's get started up again. Thank you for your patience, everyone. Next item on the agenda, 7.2, is a delegation. Jessica Colasanto, CATHET Community Action Team, and Dr. Kakatla, Medical Health Officer, Vancouver Coastal Health, regarding information provided in advance of International Overdose Awareness Day on August 31st, 2026. Welcome up, Jessica.
Thank you very much.
Just to, delegations have 5 minutes. I'll give you a warning, and if you need to go over, then I will ask for council's consent to continue, but we aim for 5 minutes.
Perfect.
Thank you.
And we do have a slideshow. Is that?
Slides are up.
Thank you so much.
Here we go.
Hi, everybody. My name is Jessica Colasanto. I am here as a representative of the Quebec Community Action Team, and I am joined by Dr. Keketla, who will also introduce herself, but is a member, an active member of our local CAT. And we are here to talk about International Overdose Awareness Day that is coming up on the 31st. Over to Dr. Keketla.
Thank you so much, Jessica, and good afternoon to the committee. As mentioned, my name is Dr. Keketla, Medical Health Officer with Vancouver Coastal Health, and I'm honored to join you remotely today from the traditional territories of Squamish Nation here on the Lower Sunshine Coast. And Jessica and I are going to take this opportunity as we look forward 2 weeks from now to marking International Overdose Awareness Day to really take a moment as a community to reflect how unregulated drug deaths have impacted this community, and we're going to highlight through the topics highlighted on this slide just some key messages. Next slide, please, Jessica. We'll start by grounding ourselves in the data quickly, and what you see on the slide here is coroner data that focuses on overdose drug deaths within the Vancouver Coastal Health region specifically, and it's broken down by local health area. The table on the left shows absolute numbers by year, and on the right, those numbers have been shown as rates per 100,000, just a different way of showing the data to help us compare with communities of different sizes. And as you can see, and this is not news to you as a community, that over time, the community has experienced significant overdose drug deaths driven by an increasingly toxic and unpredictable drug supply that's been contaminated mainly by fentanyl and other drugs. And those deaths have fluctuated by year. And as you can see, the peak number there in 2021, where there were 17 people who lost their lives. And that peak coincided with toxicity within the drug supply, but also some disruptions in terms of services and access as a result of the COVID-19 pandemic. And over time, several interventions have been implemented in the community, including overdose prevention sites, harm reduction, treatment services that have been expanded. And so we're starting to see a downward trend that we're hoping is going to be sustained, and not just within BC, but in other jurisdictions in Canada as well. I also like to reflect as we talk about numbers that each number represents a person, and each death results in significant loss to communities and families, including yours. Next slide, please, Jessica. And this slide just highlights that as we're cautiously optimistic about the decreasing numbers of deaths, that we still remain in an emergency situation of public health significance here within BC, and that the response continues to be a priority for us as a health authority. And that response includes a range of services that are timely and that can be easily accessed by people within the community. And so I included these two resources here that can easily be scanned that show the range of services that are available within the community, and also a reminder about some of the basic steps that people can take both at an individual level for those using substances, as well as to support those around them using substances. And those services have been undergone quite an expansion within the Powell River area as well. And a lot of capacity building has gone into that process. Next slide, please. And then before I hand over to you, Jessica, I just wanted to highlight the importance that overdose prevention sites have played and continue to play in terms of saving lives and of being of broader benefit to communities. They have been critical, including within the community of Powell River and area, and continue to be an evidence-based approach that we support, supported by community operators such as LIFT. The local overdose prevention site that's currently in the community that's temporarily located at Brownette site also serves as a hub that connects people to treatment and recovery services through dedicated resources. And they also have broader impacts in terms of reducing public drug use and reducing equipment lying around the community and those types of things. And we know that they have other benefits, including reduction of sort of crime and drug use within communities. I'll hand over to you in the remaining minutes, Jessica.
Yeah, just looking at the time, do you need like 1 minute, 2 minutes?
1 minute.
1 minute, great. Is council consent to do that? I see thumbs up. Okay, continue.
Great. I just wanted to point to this slide, and the theme of this year's IODE, International Overdose Awareness Day, is 25 years on, 25 years still needed. And the complexities of the paths that lead people to homelessness and addiction, which have over time become so intertwined, it's a web. It is a literal web. There is no one path in and there is no one path out. And I want to call attention to the housing continuum, which is so very important. And you can see on the left, it starts with the unhoused, the unsheltered homeless, moves into emergency shelters. We were without a shelter for a year. Transitional housing, we have very, very, very limited transitional housing in town. Supportive housing, our one supportive housing building currently has a 4-year wait on average to get in. Subsidized housing, there's again, very little. Affordable housing is not all that affordable, but that's what's considered affordable before you actually get to market rental. And the idea of the continuum is that it's very difficult to move one way or the other on the continuum. More like to hop over one, typically the journey would slide one by one by one. When we're missing significant gaps in that continuum, it makes it very hard. And when someone goes to treatment and they are unhoused, they cannot come out and be expected to move right into market rental housing. It's virtually impossible. So with those gaps, we're seeing the ramifications of that. And then quickly, just the 4 pillars, but I think most people are aware of the 4 pillars. We need treatment. We need more treatment, affordable treatment centers, but we need housing for folks to come home to. And of course, harm reduction is a very significant part of this process. It's not an either or. And join us on the 31st in the front lawn for a flag raising. Thank you.
Thank you so much. I know it's in council's calendar, and I know a number of us have replied that we'll be attending. So I look to see a number of members of council there on August 31st at 10 a.m. for flag raising. Thank you so much. Any questions or thoughts from council? Councillor Elliott.
Thank you, Chair. First of all, I really wanted to say how honored I am that you've joined us, Dr. Kekatla. It's great when you come to council and talk to us and you have the science and the numbers. One of the questions I maybe had for both you and Jessica, whom I also appreciate you being here today, is given the response we've had in our community and our community groups and our community action team and the team that has been working on this crisis over the last number of years, versus communities that maybe didn't organize the same way we did. Can you say what positive outcomes that you see coming from those efforts, and whether there's some things we could organize as a community that might improve those outcomes? Thank you.
Dr. Kekatla, do you want to respond first?
You can go ahead, Jessica, and I'll add on. Thank you.
I did say I would do some of the more local questions. I would say we most likely came out ahead in the early years. We had a jump on things. There was one winter when we had no unhoused folks for a very brief 2 months, I think that happened. And then COVID hit, right? So, and I also, to tie into that, want to just point out, like, I was reflecting on all of the deaths. 95, that's a very big number for a small town. One of the reasons we don't publish the statistics monthly is because you could correlate deaths to obituaries in the paper, right? We try to respect folks' privacy. That's why we tend to get the numbers at the end of the year. And I was reflecting on those 95 and the folks that I knew personally. And what jumped out at me was that there are folks from about 4 years ago who were walking alongside death and using our services, sometimes staying at the shelter, sometimes not. Some of those folks are tooling around town now totally well, living their best lives. And in the moment then, there was no way to say, you're going to make it, you're not going to make it, you're going to make it. It is so random. The web of the path leading into this crisis is so deep that it takes many, many different opportunities to get out. Harm reduction is here so that we make sure that those pathways are available for folks. I think I answered your question.
Thank you, Jessica.
Any other comments or questions? Oh, Dr.
So,
Keketla.
if I could just add 2 comments, I think in the time that I have been, I've had the privilege of working with this community. I have seen, I mean, we deal with a lot of data, and we can see the dramatic and significant improvement that we've seen over time. Several years ago, there was a point in time when the community of Powell River and area was the rate was so high that we were for the size of the community, within VCH that we're second only to the downtown east side. That is quite remarkable, and to see all the effort that went, and it's not just the health response, it's a community response that has over time, in addition to the other factors, resulted in the reduction that we're now seeing, that we're hoping will be sustained, is quite remarkable. The other aspect that's important as well, and again, because sometimes we're limited in how much we're able to publicly share the information, we know that we've had a lot more people, diagnosed. We know that we've had a lot more people connected to care and retained in care. We've done a lot of work within Vancouver Coastal Health in terms of tracking this information to be able to demonstrate the attachment that we're able to provide and care that we're able to provide to people. That's really been a good progress. And then I think also, as an outsider and not living within the community, but being there several times, for me personally, and this is something that's not easy to capture when we look at the data, is to be able to see community pull together, particularly when we're working as rural and remote communities with very limited resources, to be able to pull together, make things happen, to support people who are, as Jessica mentioned, struggling with homelessness and unstable housing, because we know how important that is as an underlying determinant of health. That is just one example that I think has really made a difference within the community, which you should be proud of.
Thank you. Other questions or comments from council? Mayor Wasno.
It's interesting that there have been 95 deaths here in Powell River itself. And when I look at the presentation, it looks like the main emphasis is at the end of the story and not at the beginning of the story. So the story is, why are there no barriers to dealing toxic drugs? Have you or any of your organizations advocated with our Member of Parliament and the appropriate people in Ottawa to bring more realistic penalties for people that are killing our young people and old people with toxic drugs?
I would answer that by saying the statistics that I see are showing that the actual crime is happening at a much higher level than locally. And the more we restrict, the more law enforcement restrictions we put on the drug crisis, the more toxic the drug supply becomes. In other words, they're looking for the smallest amount, that, like, what is the most potent thing that's the smallest amount. So organized crime is involved somewhere, not on the local level, I don't believe. We're just seeing the tail end of what happens when the bigger picture of that crime is not addressed.
Thank you.
Any follow-up, Dr. Kaketla?
The quick comment that I'll make, because I think it would take a lot of time for me to get into this discussion. I think it's a complex issue, as was shown in terms of what the underlying factors are that then interact with a toxic drug supply, which is why the second last slide that was shown, that shows all the different pillars that need to go into response, including the last one, which depicted the disruption of production, distribution of unregulated drugs is one aspect of it. But again, it takes a lot more complex efforts that need to come together to be able to address the overall issue.
Thank you. Councillor Doubt.
Yeah, thank you for coming and all the information you've provided. It's always a way to learn something new that I hadn't thought of or understood before. It's nice to see the number of fatalities locally going down over time, but it's still too many. And one of the things you mentioned earlier was that local supportive housing has got about a 4-month waiting list.
4 years.
4 years. Okay. I was going to ask for some more information on that and where the people are going when they leave, because obviously unless somebody leaves the supportive housing, you're not going to have a vacancy. So is there anything you can tell me about how?
Turnover rate, for sure.
Pardon me?
It is a low turnover rate for sure.
Yep. Okay. Is there any way it could be made quicker? Is there something that could be done to make it possible for people to leave supportive housing earlier?
I think filling in those gaps on that housing continuum, like having more rent controlled housing made available. We don't have a co-op, right? Like for anyone, it's how renting a place is very expensive for anyone. And so I think the government in '93, the federal government stopped supporting co-ops and that kind of affordability, mandated affordable housing. So that would be my answer.
Thank you.
Councillor Southcott.
Thank you, Chair, and very much appreciate you both, Dr. Kaketla and Jessica, and all the work you've done for many years, which I've been watching from a different perspective in earlier years, going way back to when I worked as a paramedic in Vancouver and the provincial government was considering sending representatives to Germany, where the values, the community values, if you will, of values that were being, that were influencing the system they have there are very different than here. So it's really high level decisions and not just political, but social values that result in the situation that we're in right now. That's what I see. Some of us were going to go over there and actually look at what they did because of the success that was seen. Anyway, and no system is perfect. Obviously, housing is an issue here. I think we all are pretty aware of that. Given that housing is compromised, my question is, I have seen an evolution over many years of understanding of the actual situation we're in, which is basically mitigating the effects of increasingly toxic drugs and challenging social situations for people, including stress, like psychologically, that across society. It's pretty clear to me why people resort to self-medication, et cetera, and the choices are pretty bad. Can you speak to the interventions specifically that are available to try to help? I mean, obviously, harm reduction is part of it, but I know through our community there's a deep yearning for opportunity for recovery, and we've spent this community has spent a lot of money through community forest money on Miklat, for example, which is something absolutely wonderful. It wasn't here all that long ago, because the kind of services that are in the Sunshine Treatment Center, for example, Sunshine Coast, are out of reach for most of our community. But even Miklat is limited and expanding slowly. Can you speak to what is happening in this community more recently that serves to help people take those steps. And I'm expecting housing really is a critical factor in that towards actual recovery, whatever that is for us.
Right, I'll start. Did you want to add something?
No,
Okay.
I'm chair, so
I would say if we could magically replicate MCLAT times 10 would be amazing. We are so fortunate to have them here, but as you say, they're small. It's difficult for them to grow. We know that when people leave treatment, there is a 2-week period after treatment where their risk of overdose spikes really high, which says to me that treatment doesn't work all the time, every time. So people will go through treatment, come out, they might use substances again. We all understand if you come out and you have nowhere to go, you're going to go right back to where you were. It's just human nature. And so that's why the housing piece is so crucial in all of this. We would love more treatment centers like MCLAT that are affordable, easy access. The other problem we have locally is that detox beds don't always line up with treatment beds. So somebody can say, I am ready. We have a recovery navigator position, like a positioned person at the OPS to work with folks. So somebody can be like, I am ready. Well, first they might have to wait for a detox bed. And then we have to make sure that that lines up with the recovery bed, which it's most likely not going to be here. That's very difficult. They'll only hold those for a couple of days at most. So.
Yeah. Jessica,
Okay.
I can add as well. We've heard very clearly from the community that people want services that are close to home so that they don't have to travel outside of community to access the services. And over the past several years, Vancouver Coastal Health has prioritized that request and has really scaled up in terms of the availability of services within the community. Jessica mentioned withdrawal beds, which is one example of treatment that's available right now within the Cathett General Hospital. And again, access to those beds is dependent on kind of the level of urgency based on the patient's needs. And so people, actually the wait time for those beds is not that long right now, and people are able to get in. There's been staffing, recruitment into those specific skilled positions that are required, including physicians who are able to provide the appropriate level of care. So that's just one example. So we have a range of services from inpatient to, again, transition to recovery supports, but we know it's not enough for the level of need within the community, and we're constantly working towards that. So if there aren't services within the community available for the timeline that somebody's ready to get into recovery or treatment services for, then we work with other areas within the health authority. That's not ideal, but we are prioritizing. The other aspect of it that our mental health and substance use and our regional addiction team are continually striving is this notion that we need to be able to meet people where they are at any time, and that there shouldn't be a complicated referral process. And that certainly has come into operation very well, in that people can be referred by their primary care provider or other provider. They can self-refer. They can just call one line and be able to intake line and be able to direct it to the appropriate service as needed without having to go through many different avenues. And if that doesn't work well, we're open to getting feedback around that. We know it's not a perfect system, but I'm certainly have been very impressed in terms of the capacity building, including a lot of recruitment more recently of healthcare workers into skilled positions, including counseling services, physician, nurse practitioner type services, all of those things that all come together to work. And that's separate from sort of the other community-based services that include harm reduction and overdose prevention sites.
Thank you. Councillor Palm.
Very encouraging. Thank you.
Yeah, thank you. Through the chair, I want to thank both of you for being here and sharing those statistics that are not in any way, shape, form pleasant to look at over the past 10 years. And we can certainly see the increase in deaths during COVID people living in isolation. And, you know, they've gone down, the stats have gone down a little bit post-COVID, but still we're dealing with what seems to be more influx of individuals in need of care on the illicit drug market. Our community is being greatly affected. This is one of the top issues that politicians are going to be facing the upcoming election. There's no doubt in my mind that that will be one of the top 3 issues we're dealing with here locally. Concern of citizens out there is great. And in my visits to encampments in and around our complex and behind our overnight facilities, what I have gleaned is that there are 3 pockets of individuals that have a hard time being under the same roof. Those that are simply homeless and not using, those that are using, and lastly, those that want treatment. Putting them all in the same facility doesn't lead to the best results, in my opinion. We hear that time and time again. So I'm hoping Coastal Health is listening and the government is listening, and we need to do better in that result to curb this epidemic that we're facing in the city of Powell River alone, never mind the Lower Mainland. I've reached out to other individuals in various communities nearby, and they are having success because they relocated their supportive housing outside of the city core, which has had a detrimental effect on our business core here in Powell River. And they've also got good providers, as what they tell me, that are doing a great job abiding by the rules of their contract that is in place. I can't say that maybe that's happening here, but we need to tighten things up. And I'm hoping Coastal Health is actually considering reaching out and opening the door to other service providers locally that may be able to come in and operate to a higher degree. Competition is a good thing in my world, and I'm hoping that that would be a result. But again, I thank you for sharing this information, because this is not readily available to elected officials or the public for that matter, and any information that we can get in this regard and work with you to provide better service is a blessing in my world, and hopefully things will get better. Thank you very much for being here today.
Wasn't a question there, just a comment, so we'll carry on. I don't see any other hands raised. I just wanted to thank you for coming. I know that oftentimes we seek, best practice. We look to other communities. We want to find out what's possible, what's happening, how other communities are solving some of the overdose crises issues that we're facing. And what I've learned in attending all the learning sessions that I've been to in this role is that, as you showed in that map, there's no one solution that will meet everyone's needs, that will work for everyone all the time. And so everyone's doing the best they can with the resources that they have. I know that in many circles, our community is actually held up as a very great example, the community action team, and how active they are, the collaboration that exists, the attendance of peers and members from many, I know, council members here who come to these meetings to make sure that they're learning and up to date on all the facts. It's a highly looked after, or not listen, it's a highly, brain fog. People look highly upon the CAT here. And so I appreciate the members of CAT that I see here today and the work that they put into that. And so I wanted to honor that. My question for the two of you is regarding some facts around who, obviously people of all kinds are impacted by overdoses and addiction. And my understanding is that a very large proportion of overdoses happen in people's private homes, so not where we think they do. People see maybe street drug use or OPS drug use, but my understanding is that most happen in private homes, and a major proportion of the population that's impacted by addiction and overdoses are men who work or previously worked in trades. And I'm wondering if that's still true. How can you tell us a little bit more to as a part of putting a human face on the where this is often happening and reducing some of the stigma. I know I've seen people in this room who I know their children have passed away because of overdose, and they don't share that because of the stigma. They don't want people, other members of their community knowing that private grief. So I don't know if you could speak to a little bit about, is it still accurate what I've heard in the past about where overdoses are happening and who's impacted? Obviously, it's across the spectrum, but are there some core populations that are most highly impacted?
As of the end of 2025, absolutely. So we're kind of in the middle of the year. I don't think we'll see the full picture until the end of the year. Yes, definitely the working men in the trades, like the 20 to 50-year-old age group, and then also first-time partiers or early partiers who, unfortunately don't get their drugs tested, or so those are still targeted populations that we really, really want to help and support. And as you mentioned the word stigma, we get so bogged down in this, in the stigma. That's why we say stigma kills, because the vision that people have of the people we're talking about are the unhoused and, the folks that we see using substances on the street. Those folks are actually taking care of each other. They come to the OPS, they're being cared for, they are in touch with nurses, they are in touch with support teams. It is the folks that are using at home that are the hardest to reach. And it is the stigma around all the conversation and the negativity. I would say we are doing a great job. I think we have really great relationships with folks. They are honest with us. They come to us when they need help. I think we're doing a great job. Is there more that could be done? Absolutely. So much more could be done. But we are a leader in the province, and people recognize that around the province. So,
we've had a pretty. Dr. Keketla?
I could add two more things to that. Thank you, Jessica. I think you brought up an important point around stigma, where people's perception might be of certain populations or specific types of people who are impacted. But again, these types of deaths can impact anybody, from people who have substance use disorder and diagnosed conditions to people who are just experimenting and are not regular drug users. The other thing too that I wanted to highlight was that men are impacted mostly, but as you may have seen from the Chief Medical Health Officer's report for Vancouver Coastal Health that came out a few months ago, is that we do have women also, particularly women of childbearing age, who are impacted and who are very vulnerable, including within periods of pregnancy or that perinatal period and early postpartum period. And so this really is a reminder that, again, communities are different and impacted differently, but also the picture of who we have as people who are impacted by overdose drug deaths. This is a reminder that it could be anybody, and anybody of us could be impacted by these types of deaths. So this is why it's so important for us as a community to come together, and this is why the community action team, and you're right, that is held in high regard as an example across even within VCH. I certainly share examples of the work that is made possible by bringing all those different partners together at that platform. And we've been able to share this type of data, be able to have discussions about it, to be able to say, okay, what's next? Who do we need to be targeting? Who do we need to bring closer to be able to continue working on getting to that zero deaths related to drug use?
Thank you. So we've all had a chance to go around once. We've had quite a bit of discussion on this topic. I'm going to check for council consent to continue on with questions and comments. I do not see full council consent, so I did not see full council.
Could we, hands up?
Yeah, I'm looking for council consent to continue the conversation. I don't see full council consent, so I will thank you very much for your presentation, and thank you very much for coming here today.
Thanks so much.
Thank you.
All right, on to item 12.1, accessibility and zero waste at city outdoor events. We have the Director of Parks, Recreation, and Culture.
Perfect. Thank you. Through the chair, thank you, Mayor and Council, for the opportunity to present this report to you. The purpose of this report is to provide an update on progress made to increase accessibility and zero waste at city-run and city-permitted outdoor events, and receive direction moving forward. This report follows direction from Committee of the Whole in September of 2024, requesting options to increase accessibility and zero waste at city-run and city-permitted outdoor events. Please note that the roles overseeing the operational aspects of these events were in significant flux from the time of that direction until the early months of this calendar year. This report outlines our general approach to the outdoor events from both an accessibility perspective as well as a zero waste perspective, including some of the approaches we've trialed at recent events up until and including Canada Day. Moving forward across all events and with both accessibility and zero waste in mind, our main focus for low cost, high impact improvements in 2027, in summary, include improving event signage, further attention to seating setup, keeping our current pathways as clear as possible, utilizing an accessibility checklist with the understanding that the accessibility committee may be re-engaging in the near future, providing clearer guidelines to event organizers and vendors, and further leveraging operational partnerships. While these improvements are modest, they can be done with current staffing and current budget levels. At the end of the day, staff's recommendation is that the committee recommend that council direct staff to continue exploring additional operational approaches to improve accessibility and zero waste at city-run and city-permitted outdoor events. Happy to answer questions on any details. I've got Manager Clarkson and Manager Ryer here to answer anything that's more on the ground related.
Thank you very much. And I want to acknowledge I skipped over the consent agenda, so we'll get back to that after we finish up with this item. So first of all, we'll start with questions. Any questions on the report from staff? Councillor Elliott.
Thank you, Chair. Also, Director Bretzlaff, I want to tell you how much I've really appreciated your work over the last number of years, and I understand you're moving away, and it saddens me greatly. So thank you so much. The question I have is some of the things I noticed that we were piloting, and I got to talk to staff about them during the July 1st weekend with increased access to recycling and things like that. Those obviously came with a cost and aren't part of the zero cost. Do we have some thoughts on what it would cost to increase access to those types of services in these events?
Through the chair, the costs for the trial were absorbed through our minimal budgets that we do have for these projects. So we didn't absorb that operationally. At this point, we could continue that at an operational level and still absorb the same costs into our current budgets.
And so those were our city kind of run events. Things like the Logger Sport or events run by others, we are not providing that same service. Would we be able to figure out a cost to that as well so that we would be informed about that?
Through the chair, there are a couple of options for that. We could have staff incurred costs that would be above and beyond our current budgets. We would not be able to absorb that into our current budget. However, when there are external events that we are permitting as part of the permitting process, we do require groups to provide waste management plans. We have not been overly prescriptive on what goes into those plans, but we could, as an option, tighten those up, and we plan to take a look at that for 2027.
Thank you.
Additional questions from council? Councillor Southcott?
Yeah, thank you. And I really appreciate this too, as well as we're going to miss you. Because the work goes back to before September 2020, is it 22? When, yeah, this report is a result of. So that's last term, but it started a long time ago. And the question is, the service that the RD provided and has continued to, as far as waste management, basically was it was provided by contractors, the Let's Talk Trash team. And I'm wondering if there's been any thought to promoting it, or is there a possibility of that sort of service being available? I haven't heard that there is, but obviously this is a whole piece of work, and I'm wondering if somebody else could do it, sort of directed by the city. Is there a possibility of that sort of? I mean, this was kind of suggested in your report that you're going to work forward to solutions.
Through the chair, we would recommend looking at possible operational solutions that fit within our current budget. We believe it could be a modified approach to that. With a volunteer approach, there would need to be oversight over volunteers for recruiting, training, retention. We currently do not have that capacity in our staff nor our budget. So we would be needing to continue to look for creative solutions that could still accomplish that, but in our current budget.
Councillor Doe?
So combination questions and comments, I guess. And I think it's back in 2022 that the provincial government actually provided some funding for an accessibility committee in the area to look into accessibility in all the parks and the recreation facilities, and they spent a lot of time working on it and came up with some recommendations. And it hasn't resulted in any major changes in the accessibility. And I understand what your point is about not being able to do a lot of different things without a budget. And that's disappointing, but I still think we need to work towards having an accessible park for everybody. And, as some of my family members get older and have more trouble getting around, it's getting impossible for them to actually attend and participate in the major events, which the report says mostly happen at Wellington Beach, where it's really difficult to get from a vehicle to a wheelchair to the place where the event's taking place. And had people doing that. I understand. I noticed actually the zero waste containers at the Canada Day celebration. I was really happy to see that, and that's good. And I think we could go. I would like to see us go actually to a requirement that happen in all events that are in that park and other parks, so that the citizens would get used to doing it. Because if people get used to dealing with their waste in the appropriate way, we'll get rid of the problem that's pointed out in the report, that people aren't sorting stuff as much as they could, and it has a cost. Actually, it makes it more expensive. But I'd like to see us do a little more. And I know there's a parks and recreation and culture wide plan that's in the works to come up hopefully next year. I think that's when council was scheduling it to be. And I'd like to see some actual budgetary and spending improvements in there. I know it's going to be hard to balance the rest of the budgeting process to make sure that those things can be done. But I'd rather see some us looking, or council at least looking at providing some funds to make those improvements to the park. And I think a way to start might be that Parks department-wide plan.
Thank you. Councillor Palm.
Yes, thank you, through the chair. Our loss will be Nanaimo's gain, no doubt, Director, when you leave on September 4th. But I wish you all the very best in your new position. Post-COVID, it's nice to see the number of events listed in your report that are making a comeback. There's one left off that list that I'd like to have you address before you leave, and that is with the diversity of our community becoming more and more diverse, that cultural day that we used to hold at the complex has been lost. I would really like to see a recommendation from you before you leave that somebody entertain bringing that back for the benefit of the community. It's a great day, well attended, and everybody has a great time in our complex, which in terms of waste is well under control. Thank you very much.
All right, one question from me. One, I guess, question, I'm trying to circle the square on this. I know for Blackberry Fest, there's a expectation of vendors to, so it's a city permitted event, not a city run event, for vendors to manage their own waste. And I see two challenges with that, and I'm wondering how they might be addressed. One is people get something and then they continue walking, and so they're no longer at the place where they bought their food from, and then might feel awkward putting garbage to another person's booth. And so having event specific zero waste containers is very important. The other is we actually don't have like institutional or business recycling and composting in this city. It's a paid for service, but only for certain products. And so there isn't actually the option for organizations to dispose of that recycling, whereas the city does if the city was collecting it. And so I'm wondering how to circle the square on putting it on the vendors, but vendors not having the opportunity to dispose. And so how did that fit into your thinking, and do you see any resolution for that?
Through the chair to the chair. I think there's a few circles or squares to circle. We're continuing to try to do that. In addition to the vendors having the requirement for their own waste management plan, we still do some waste management. So it's not, we don't rely 100% on the vendors, but we're trying to put some of that on their shoulders. I couldn't answer off the top of my head the organics challenge. I think that's a broader challenge right now that we all face.
Thank you. So any further questions, and then we'll go on to any comments or thoughts. All right, any additional comments or thoughts that you want to share with staff about this report? Sarmina?
Thank you, Chair. Well, amen, everyone else. I think I've already spoken to your office and wished you all the best in your new role. It was great to see steps taken forward at Canada Day, and I never expect everything to happen all at once, and it takes time, but any step forward is a good step. So I look forward to seeing that progress over time as the years come on. So thanks for your service to the community, and all the best to you.
All right, I will, be the additional person to thank you for your service to the community and wish you best of luck in your new role. Really appreciated the time that you've spent working at the city, and the professionalism and the quality reports that you bring to council. Not sure if we're going to see you at the next committee of the whole before your last day. Any other recreation reports coming up? See some nods? Okay. So two additional thoughts that I would love for you to keep in mind as you continue on in this process. One is, the importance of carrying on and training and repetitive nature that someone just mentioned. I did attend Canada Day. I was thrilled to see the zero waste stations there. There weren't the full number of, I think there was container recycling and garbage, and then there wasn't maybe compost. I forget how it was, but I got there and I was like, I know something can be done with this, but not in these 2 bags. And I asked the person who was working in there, and they're like, I don't know. And so you have a group of people that don't know what to do with things. And so over time, that education piece and repetitive nature of people getting used to knowing what goes where is super important. The other item, we haven't talked a lot about accessibility, and I think, I know when the presentation came to council, Dave Hodgins, maybe that was the presentation that he did. And also I sat in on a number of the accessibility committee meetings. Something like Blackberry Fest coming up, there's often a few designated spots for accessible parking. And then there's also the transit that goes up and down Alberni, but the stop where the bus stops is up that steep hill and is quite inaccessible. And so we have a number of challenges just with the geography of our town in terms of event accessibility. And I'm wondering, like, what tools would an organizer have to firmly, like, are they able to designate and to, I don't know, supersede, for example, the parking lot in between like Sunny Deli and BMO, in between Willingdon and Marine is city parking lot, and it could all be designated for accessible parking, but I don't know whether organizers have that ability to do that, and whether there are any additional solutions to have a more accessible bus stop. So like I think there's challenges for organizers to think more clearly on, and I'm wondering what opportunities there are to do those things.
Through the chair, my recommendation would be that collaborative approach might be best approached through the accessibility committee with some specific recommendations coming from them. Currently, you are correct. The vendors do not have the ability to do that. We would have the ability if we are running that event, which we're not. We're receiving all the information from them on what they want and how they want this set up. We've never received a request for something like that. It doesn't mean we couldn't get involved and start promoting that. But we've not evolved to that level yet in events that are not run by the city.
Yeah, it makes me think about the city through government funding and government requirements, I think even though I know that we haven't been able to go far enough, we actually have had the resource to do thinking about it, with some organizations just haven't had that time or the funding to think about it. And I think there's an opportunity for us to play a bit of that educational role. Like, here are some things that you can ask for. People might not even know that they can ask for those things. And if there'd be any cost. The second question that I had, though, was about transit. And if someone requested for a more accessible transit stop for shuttles, would that even be possible? And that might not be a you question. That might be more of a Mark. Yeah, no one here.
Yeah, that would be a Mark question that we could get back to you on.
Okay, thank you. Additional comments or questions? So Councillor Elliott and then Councillor Dowd.
So when we are having folks doing outdoor events that is not us, would it make sense for us to have a bit of a book to hand out to these folks that has a checklist of things they could ask for around accessibility, or things that might be possible that they could ask for? And it kind of, I don't think we have that yet. And I think developing one of those in our future as part of this motion to continue to exploring options would be just good to have on the radar. I don't really expect to say, other than maybe confirm I'm right, we don't have one of those, but those are ideas that we could be more friendly about, I think.
Through the chair, we don't have one of those, but the accessibility checklist that we are proposing to follow is something that we would, under the endorsement of the accessibility committee.
And then, a section for waste as well would be great. I think in general, our city could use better access to receptacles for waste for the general public walking around in our city. And that may be a different topic for a different day. However, it's sort of part and parcel with how outdoor events need to pay a particular attention to that, because it's already a gap. So.
Councillor Dowd.
Yeah, I think we've had lots of discussion, a lot of good questions. I'd like to move the recommendation in the package that council directs staff to continue exploring additional operational approaches to improve accessibility and zero waste at city-run and city-permitted outdoor events. And since it's committee of the whole, I don't think I need a seconder. So I'll just say that if this motion passes, I would hope that council or staff would continue to do that. They've done well in the past. I hope they continue to do it. And my hope would be that this initiative gets included in the discussions of the future Parks, Recreation, and Culture plan that we're going to be digging into, or council's going to be digging into over the next couple of years.
Thank you, Councillor Dowd. Any discussion on this item? Councillor Elliott.
I support the motion, and I commend staff for the very wonderful report, the proactive way they've been doing the pilots and projects designed to explore these options. I encourage it. I know the pilots all have to be within existing budget, but I hope they can help direct some of our budget items in the future to make things a little more easy for the city to have accessibility and zero waste throughout the city. So thank you for the report. Keep up the innovative ways of exploring, and that's my comment.
Councillor Doe. Oh, no, that was from before. Yeah, I know you've already spoken. Any final comments on this? One question that I have for staff based on this motion. So this motion encourages you to carry on, but doesn't speak to reporting back to council on additional progress. And so if you could speak to what would the operational standard be, and should there be an amendment on this to report back on, say, like Q4 2027, like how much time is needed to continue to make progress and report back to council on that progress?
Through the chair, off the top of my head, I think it would be best to go through a season of events, and I think Q4 of 2027 would be a perfect time.
Okay. Thank you. So is someone willing to, I could move that amendment to add at the very end and report on progress to council in Q4 2027. And again, it's committee of the whole, so no seconders are needed. Any discussion on that amendment? All in favor? Any opposed? Carried unanimously. Back to the main motion. So we've got the main motion plus the reporting on progress Q4 2027. Any further discussion on this item? Seeing none, all in favor? Any opposed? Carried unanimously. Thank you very much, and I look forward to your final presentations to council and committee of the whole over the coming weeks. Last item is dogs at Willingdon Beach. This is an item that Councillor Elliott asked to be on the agenda, and I believe staff may have some comments. Councillor Elliott, could you? Oh, sorry. Yeah, consent agenda. I told you I would go back to it, and I didn't. Let's go back to that item that I missed earlier. Consent agenda, item number 8. So we have a consent agenda. Is there anyone from council that would like to remove something from the consent agenda? All right. Can I have someone move the consent agenda? Councillor Southcott. All in favor of the consent agenda? Any opposed? That's carried unanimously. There you go. Now we move on to 12.2. And so maybe Councillor Elliott, could you introduce the topic, and we'll see if staff are able to provide any updates or clarity.
Thank you, Chair. So the reason I asked for the agenda, this to be on the agenda, is we received some correspondence discussing how dogs at Willingdon Beach and even Mowat Bay, even although that wasn't specific to the letter, are not really following the rules that we have for those areas. And the letter specifically talked about an incident that resulted in injury of children and was asking for better signage so that folks understood the rules better at Willingdon Beach. And Willingdon Beach has kind of some interesting rules that contradict one another that are not easily for everyone to understand. For example, there are no dogs allowed at Willingdon Beach, with the exception that you can have them on a leash on the path from where you park your car through the beach to access the trails beyond. They're not meant for you to hang out there or any of those things. It was simply a concession to allow folks to go walking on the trails beyond Willingdon Beach with their dogs. And so the signage says no dogs, and then has signage that says your dogs must be on a leash. They're a little bit contradictory. So what I wanted to bring to this committee was the idea that maybe we could ask staff to do some bigger, better signage so that people can better understand the rules at Willingdon Beach and make it easier for bylaw officers to enforce those rules when they come up. And so that was the introduction of the topic. And if staff had any comments on that, I would be loved to hear them.
All right, thank you, Councillor Elliott. Any comments from staff?
Thank you. Through the chair, I can say.
I don't know, the microphone might not be on, or maybe you need to direct it to your face. Yeah.
Through the chair, I can say that parks and bylaw enforcement, we have had some discussions about the topic and looked into it a little more. I can confirm that the parks bylaw does have a provision within the definition section which provides for transiting of a dog through the park on the path, on the leash, for the purposes of getting to lands beyond. We also looked into the scope or the boundaries of the park and confirmed that it extends to the high water mark. So it includes Sandy Beach area as part of the park. Signage, we have noted a few deficiencies and talked about some ideas. And so that side of things is under review, and we're looking at some options. And I think Parks may have already sort of advanced that conversation on their side as well, in terms of coming up with some preliminary thoughts on additional signage. There are some constraints in terms of digging and placing too many signs on the beach for a number of different reasons. But there certainly are, I think, some opportunities for us to clarify what the rules are. And so that is something that we're in the process of doing.
So thank you, Peter, for bringing a bylaws perspective, and it sounds like things are in progress. Is there additional comments from Parks or any additional information from Parks about that? No? To add?
I would concur with our corporate officer. We're currently looking at the signage.
Okay. Thank you, Councillor Elliott.
Thank you, Chair. Specifically, does a motion from council or direction from council help us, or is this something that will be part of your operational response to what we've identified? Do we need to do anything as council?
I would say that it is something that's been brought to our attention and we're actively working on anyway. A motion would just put it on record, but we're already doing it, so I don't think it's necessary.
Thank you so much for that update. Appreciate it. In addition to this item here, I just wanted to let everyone know that I won't be able to attend council on Thursday due to a personal thing that I have to do. And so I don't know when I announce that, and we don't have a place on the agenda for it, but I just wanted to make sure everybody knew that.
Thank you, Councillor Elliott. So we have no more late items, no notice of motion, and so now we move on to public clarification period. So this is where members of the public may ask questions to clarify items that have been discussed during the meeting for a maximum of 2 minutes. Are there any members of the public who need to clarify anything or have a question? Welcome.
Kathy Koralik. I just want to comment and say.
So interruption, this is a public clarification.
I will be asking a question.
Okay.
But to lead up to that, I just want to say I am part of Rotary, and Rotary and Chamber of Commerce are doing Blackberry Festival. Thank you to the city for providing the equipment needed to block off the roads. I would like to know how, if the road is blocked off, you would how you would do moving people through Marine on a bus when the road is blocked off to make it more accessible. And secondly, the parking lots are designated for handicap parking are usually taken over by the staff that works at those stores or the restaurants. How do you handle that? simply because they don't listen to anyone else. So it would need someone in a different kind of authority, which we don't have. So who would provide that to say, no, you can't park here. It is going to be for handicap parking only, which is very limited.
Yeah, great questions. Just to clarify your first question about the bus, are you looking for a bus to go down Marine?
Well, when you're saying the inaccessibility and how difficult it is on Duncan at the bottom of the hill, or even Alberni where it's hard, and if you have a disability, it's very difficult because it's on a hill, sidewalk levels are high. And so where would you propose to make it easier for people to get off of transit and take part in the festivities? Because at this point, it's very difficult.
Thank you. Okay, so you've got two questions. I'll look to staff and I'll just note that we don't have someone from transit and operations here to be able to answer that question. And so that might be more difficult. But Councillor Almeida, you had your hand up.
Yeah, I actually sent a message over to staff during this conversation, but I don't know if we're going to have a solution for Friday, and no solution was proposed. I would imagine it would be trying to find something that would be a little bit more level than the bottom of Duncan, which is 90% of our town is more level than the bottom of Duncan. So is there a solution for Friday? Probably not. And I don't think it's going along Marine. That would be ridiculous, I guess, to do anything through our through the blockade. But you know, I think it just opens up the conversation, which is a continued conversation in our community, is what are the ways we can do things differently and better than what we've done before. And I think that's the conversation that we're looking at today, and how can we improve the process the next time from how we did it before. And that's not just with the festival or accessibility, that's waste in general. Even I see that when it's recycling and garbage day, or in my neighborhood, I'm always surprised how few green boxes are out on the street as well. So it's a community-wide area of improvement that just takes time, and slow steps to improve each time is what we're looking for.
I have one more question.
I want to refer part of your question to staff as well. That question around parking and authority, for example, that spot in between Marine and Willingdon beside Sunny Deli. The question was, how would they ask for that? Who has the authority to stop? And I'm looking to staff, whether that's a bylaw or parks thing, as part of the organizing. How might that be possible? Or who could she follow up with to find out more information?
We would have to look in terms of authority, as that highway is not our specific jurisdiction, but I think that the best way to do it would be through the permitting process at the beginning, where we would be working with the event organizers. And I don't have an answer today, but I think that that's where the conversation would start.
Okay. And just to clarify, the parking that I'm speaking of is not on Marine. It's actually a city-owned parking lot.
Okay, then again, starting with the permitting process and then looking at internally, we would be able to look at it, whether it's bylaw or operations.
Okay, so you've heard that maybe you might be able to ask for it next time, now that you know that it might be possible, but it would have to start earlier. And you had a second question?
Yes, the last question is, how would you deal with people that are disabled, having their dogs on leash, walking down the trail at Willingdon, and they have to stop at a bench to sit? They have their dogs on leash, but they can't walk any further. Now they're on the grass. How will that be affected?
That's an interesting question.
Well, it is, because I have two dogs, small dogs. I have a husband that can't walk really far, so he takes his time and sits on benches on the grass. So now that's going to be a problem.
Right, thank you for the question. And I'm wondering if staff of the current bylaw addresses that in any way or allows for leeway.
Thank you for the question. Bylaw staff regularly patrol parks, including Willingdon, and the first priority is education. If they think that someone is not complying with the bylaws, for a situation like that, I think they probably just have a chat and you just let them know that you're just taking a rest, and I can't see that being an issue in terms of enforcing the ability of people to, through our bylaw, be able to walk on that path with your dog on a leash. So if you've got to stop and take a rest on a bench, then you're just taking a little longer to get to where you want to go. And I really don't see that as an issue.
I'll take that into consideration, and thank you
Thank you.
very much.
Additional questions from members of the public? Anyone online? Councillor Elliott, did you want to respond to?
Yeah, that question that Ms. Corlick was talking about. The main issue seems to be people wanting to stay at Wellington Beach to play or spend their day with their dog, and that's prohibited. And so the intention is you can walk your dog, and if walking your dog means you have to have frequent rests for accessibility, and you explain that should an enforcement officer come up, I agree with our corporate officer. I don't see that being an issue. But what we have is a lot of folks doing off-leash or a mixture of hanging out and picnicking with their dogs, or going up to the play area where the kids are and holding their dogs on leash. And all of that is not allowed. So that's the problem, and enforcement officers have a hard time with it because it's not well signed. And so that was kind of what we were trying to get at. It is a bit of a tricky thing, and so.
Thank you, Councillor Elliott. Councillor Doat.
I think this is where balance and reasonableness, I think, come into the equation. I think the intention is that people who are walking their dogs through the waterfront of Wellington Beach Park have their dogs on a leash. I think the complaint to the problem that the letter writer was talking to council about was the fact that people they know had been bitten by an off-leash dog. And the question was, well, what can we do about it? Yes, it's complicated when you say you want to be able to have people walk their dogs on a leash through Wellington Beach Park instead of making the entire place a non-dogs or dog-free area. Nobody really wants that. We want people to be able to use it to take their dogs along on a leash, hopefully restraining them and taking care of the other people in the park. And if we've got bylaw officers out there, I would hope they would use kindness and compassion in talking to people about what they're doing with their dogs. The idea is to have safety for everybody, not to have people biting your dog, to have your dog on a leash so they don't run away, and getting out there and giving your dog a walk, which is a lot of fun. I think it's all about balance and looking at what you're trying to do, because I don't think it would be possible to get a big enough sign to talk about every eventuality and where the border lines are. So that's just my 2 cents, but I think we can find a solution that probably works for everybody.
Thank you. Look back to if there's any callers online. No. Anyone else from the audience? Seeing none, our business is concluded. We're adjourned.
Should ever warm in here.